Check, check. Good morning, everyone. On behalf of the entire ICI fraternity, I welcome you all to the Day 3 of Global Professional Accountants Convention 2023. Health and wellness. Well, it's not a goal, it's a way of living. And today, this very special session on wellness insight, it is very important for all of us to harness this knowledge as we continue to grow, work better, being happy and very healthy individuals. With that, without wasting any further moment, I would now be inviting a very special panelist that we have with us. Can we have a great round of applause for Dr. S.K. Nigam? He's a consultant in internal medicine at Apollo Hospital. So it's an honor to have you here with us. So I now request you to take over this session.
Quite a while for things which
Mike.
half of the things already must have been covered in yesterday morning's lecture. Because we know health is a very vital thing, but more importantly, we never think in terms what it is with us, or otherwise we see on newspaper or on a TV. I have a bad habit of asking few questions, so I will keep on asking questions. So don't feel bad about it. Can you imagine what will you be doing after 15 years on this day? Anyone can answer? Yeah, come on. Yeah. Tell me. Okay. And what were you doing 15 years back from today? Okay. And in terms of money, what was the money level? And after 15 years? Stress. The most important thing that I am asking, that stress has become an inherent part of it. And it takes hell lot of wealth from you. Am I correct? Can I have next slide? Next slide, please. Now there is a standard definition by WHO. Health is blah, blah, blah. But well before WHO, our Ayurveda has a clear distinction of defining what is health. Samadosha, Samagnisha, Samadhatu Malakriya, Prasanna, Atmanindriya. Now, Mana, Swast Itya Bhiyati. What is the meaning of it? Next slide. Next slide, please. Balance dosha. Ayurveda says there are 3 dosha. Vata, Pitta and Kapha. Right. Samagni, balance healthy lifestyles. Samadhatu Malakriya. In older days, senior people used to think only 2-3 things. If you are passing flatus or motion, passing urine, digestion is good. And if you have cough, you are throwing up cough in the morning. So you are healthy. Then prasanna, indriya ka khushi hona, man ka khush hona, and mind and soul in content position. Next slide. To clarify it in a shorter way, previously, a healthy person is defined as someone who has doshas must be in equilibrium, digestive fire in balanced state, and tissues and waste working in a normal balanced state. The sensory and motor organs, sense organs, mind and soul must be also in present state. So that is what is health, right? Next slide. Now, simple question. If you have heard yesterday's lecture, probably might have been covered. What is the lowest age when heart disease starts? AI can help you. Okay. So the earliest known age where the atherosclerosis, the precursor of the heart disease, has been found in 3-year-old kids of Korean born. So the cholesterol content increasing in the heart vessels starts around the age of 3 years. That is what is documented in autopsies of the Korean war kids. And who is using the mathematics most every day? I can have an answer at a later date. You can think of. Next slide, please. You must have heard about quite a gross improvement in the whole world. We had infectious disease deaths. We have conquered good number of them, barring a ditch by COVID. But overall life expectancy is going higher and higher in past 50 years. This is a graph that the life expectancy is going up and up all over, including India also. Next slide. Now what we are talking about is the lifestyle diseases. Everyone knows about it. They are there, and because of the rapid industrialization, globalization, everything is happening. And one of the most important things people have forgotten that how it started all over the world. It was in 1972, one scientist, Arnold Borlaug, got Nobel Prize for genetically modifying the wheats, which has led to increase in productivity of wheat all over the world. If you remember, the days of famine have not occurred in spite of drought in this country for last 50 years. So it is all because the food quality, food abundance is there. Next slide, please. Common disorders are diabetes, heart, hypertension, obesity, high cholesterol. You all know it. There's no point in repeating it. Next slide. Now, what is the facts? They account 63% of all deaths. 80% of deaths occur in low and middle income countries. We are still in a middle income country. We are yet to become a developed country, but we are cruising towards becoming a developed country. More than 9 million of all deaths are due to NCD and importantly, below 60 years of age. Around the world, NCDs affect women and men almost equally. And important part, all are preventive. Next slide. NCD is the only health problem, but it developed challenges as well. 1.5 billion adults 20 and older were overweight. So overweight was one of the important factor of all kinds of illnesses. 43 million children under 3 years of age were overweight in 2010. Under 3 years of age. We used to talk about malnutrition, lack of food availability, fat. All over the world, what is happening? Tobacco, everyone knows, and well-known poison, and removing major risk factors is very, very important factor. Next slide, please. The burden, no point of repeating the statistics. Everyone knows it is very, very high, right? And it is going to increase. This is an older slide, but we have already passed it. It is increasing gradually. Everyone knows it. And unfortunately, in a recent past, number of deaths in younger person on account of heart are increasing. Next slide, please. These are the statistics from India. Everyone knows they are going high. Next slide. Now, how do you prevent? Unless we know what is causing the trouble, there are risk factors which are created by us, which we cannot control. But what we can control should be our motto to know them well. It's basically behavioral lifestyle, environmental exposure. Pollution is one of the important factors. Hereditary characteristics are there which one cannot change. Next slide, please. Now it is self-test. You read out all these questions. Are you a non-smoker? Hold back. Do you check your BP regularly? Do you drink within limits? Do you avoid self-medication? Do you take small time each day to relax? Do you take minor hassles in your stride? Are you having ideal body weight? Do you eat balanced diet? Do you exercise regularly? If answer in yes and no, if number of yes is less than 7, it's a warning thing. These are the easiest possible thing which you do not need to go to doctor. These are the things which you can self-assess, sort of a self-assessment tool. Next slide, please. How the risk factors get you into the diseases pattern. Tobacco, alcohol, physical inactivity, nutrition. Right? They come from add up to the physiology of the body. Increase in body mass index, that is obesity, blood pressure, rise of blood glucose and cholesterol. And the outcome is the last one: heart disease, stroke, diabetes, cancer, respiratory disorders. Next slide, please. Next slide. Another question. What is bad for health? Sugar or alcohol? Sugar. Both. Right. The clear fact one should know on this day, sugar is equally bad or rather more bad than alcohol in moderation. Not because that alcohol is a good industry backing, so I am promoting alcohol. No, nothing like that. I don't have any shares with any of the blah 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 or keep walking. So sugar is really bad, and unfortunately, it's again the industry that created havoc that fats are bad. Way back in 1972, WHO knew that sugars are bad, and they were about to declare that sugar should be controlled by everyone. But that particular end of the decade, USA has maximum number of corns, and they were making corn sugar. And corn sugar is 3 to 4 times sweeter than our cane sugar. And corn sugar's main content is fructose, whereas the cane sugar contains sucrose, which is a mix of glucose and fructose. Everyone knows about it. So the fructose was bad. Now, how do they check that if the corn is being labeled as a culprit, they will lose a number of their agriculture produce. So they did a trick. And it's a real trick. It's on record. Their food minister and agriculture minister went to WHO and ensured that cholesterol is declared as a culprit. Cholesterol was not a culprit. And today we talk of cholesterol, everything, LDL, and all this thing, and our journalism is talking about LDL cholesterol, right? But the important factor is that sugar is another main culprit. And what are the cheapest drugs available to all? Any two. Oh, they're cheaper. Still cheaper than that. Everyone is taking paracetamol. Everyone is taking metformin. It's for all. And since they are cheapest, no industry is coming forward to promote them in a big way. I'm sorry, don't feel offended. One of them is exercise. For doing exercise, you do not need always spend money. Unless you are in a modeling business or a Bollywood or Tollywood industry, you don't need kinds of gyms. And second is sleep. Sleep is in your hands. Sleep. You can sleep very well. How much? 7 hours minimum. Sure, sure. That is where the wellness concept comes. It is not that when I talk of exercise, if you do good exercise, I hope you will be tired enough to get off your botheration of business, income and outputs, or stress of delivering some targets. If you're doing physical activity, half of it will be covered. And when the next slide, the remaining things will be covered. Next slide, please. Now, standard thing, but one can do easily at his home. Get their weight done or get weight done anywhere. In older days, used to, the railway platforms used to have that weighing machine, but now they have disappeared. But weight in kilograms, divided by height in square meters. That's a BMI. Standard one should have up to 23. It is very uncommon. Right? Next slide. Another assessment is your waist circumference. For man, it should not be more than 90. For women, it should not be more than 80 centimeters. These are the easiest possible method that you know how much you have to achieve. These should be your targets. Next slide. Now here comes your stress. Because that is the biggest problem. Now here another question that I have not written here because I was not supposed to ask this question. There are two people in this country who do not have any stress. Can anyone name even one? I'm talking persons, I mean by proper noun. They have name. You are one. Right. I hope you all know him. But I am talking a person who you all know. And there are two persons. Who is the second one? You are one. Padosi. But the concept of work comes in relation to stress. If I am running out of time, please inform. You may agree, you may not agree. One of them is Narendra Modi. Okay. Some may not agree. But if you look at his score, does he ever look stressed? Does he ever look tired? He always looks fresh. Agreed? Right. Right. So to 50% you are right. But then what else he is going to achieve? Tell me. If he has to give stress, what else he is going to achieve? He is PM already on 2 occasions. So for him, nothing to achieve. He will remain PM. Right? And in our constitution, president is slightly, in our type of parliamentary democracy, president is a titular head. So why should you have give attention? Correct? So one of them is Narendra Modi. You all agree? He's our honored Prime Minister. And we should take some cues from him. I have asked simple question. Have you ever seen him tired? Never. He always looks fresh and bright. Right? And I do not know how much he works, but people say he works for roughly 7 to 18 hours. Right? And second person, I have asked two persons, so you flip the coin. If one side is Narendra Modi, who should be the next side? Head and tail. Agreed? Agreed? he has no tension because for him, he knows that the road is more or less closed. He knows it. That's why he does some sort of gimmicks that even a common people are realizing how do we think him as our leader. But there should be opposition. But the way he is behaving is a really trouble. So these are the two fellows who are not having any stress. So you decide what is your goal, this way or that way. So your stress will be over. So the small things are there. Positive thinking, because we always think something will go wrong, right? Because we follow there is one law, Murphy's law. If you think that it will happen, it will happen. And we always remain skeptical about our competence plus our efforts and our luck. We never think that our confidence we will achieve. We do have some doubt because we always have our devil's advocate. Nahi karne ka, right? So these are these small tips. Next slide. Now here comes your answer for your alone exercise, accompanied by meditation or pranayama or some exercises, which relaxes not only your body but also your mind. Next slide. How do we have to respond to our stress? We respond, recover, and relax. But what happens with us on a routine way? We are responding to one stress, getting another thing as a stress, and we are in a cycle of stress. And stress clearly kills your body by one important hormone, that is cortisol, what we call as the steroids. It increases your BP, it increases your diabetes, it increases your hyperacidity, and it takes away your sleep. So try to respond and knowing full that you have to relax. You know only one step that we have to respond. Just another question. How many of you are active? Yeah. How many are active? Okay. Okay. Almost good number of them. How many of are reactive? Very few. And how many of are proactive? You all know the difference of being active, reactive, and being proactive. When you learn a lesson from today, I hope something will go inside, that something can be done. It's not leaving anything at its own course. Next slide, please. Easiest things. Walking, 30 minutes of walk, brisk walk, jogging, cycling, heavy gardening or housework on more than 5 days a week. If you can't do, 5 days is enough. Or exercise should be of that level that you slightly get out of your breath. Those who already have a heart problem, they should avoid, but they should have a easy walk for 30 minutes, right? Even 2 times a week, 15 minutes of brisk exercise, high intensity exercise. 15 minutes is as good as 5 minutes of 30 minutes of walk for 5 days. So both are equal. So if you do not have time for 5 days, then keep weekends, not for parties, but for these kind of activities, right? Next slide. The same thing in a different form, so that repetitively things are being imposed that yes, these things can be done. And keep walking. Those who have a weekends, for them who know who is a keep walking fellow, so keep walking. Right. Next slide. Good diet, balanced diet, right? You should have good diet which is consisting of good amount of proteins, carbs, fats, minerals, vitamins. Next slide. Small single slide comprising of all possible things that one can do. Good sleep, regular exercise, avoid smoking, good personal hygiene, be happy, and eat a balanced diet. Next slide. Now the second part of the talk, which is wellness. For so far, I've been talking about the focusing on wealth. But when you go through all these things, that becomes a part of wellness only. Don't confuse it with a health, wealth, and well-being and happiness. Health is a static condition. Wellness, well-being, and happiness is a perception of state being well and happy. Wellness is not a static state of being fit or perception of being happy. It is a process of achieving a state of being healthy, happy, and maintaining all those states. Next slide. This is a comparative chart. I don't want to go in detail. Next slide. Next slide, please. How often should we go for our checkup? You buy a car. Some company gives 1 year service package, some give 4 years package. And they do remind you that your service checkup is due, maintenance check is due. Our manufacturers do not inform us that we should go for our checkups. I have written here, from every 5 years from the age of 30 years, every 2 years from the age of 40 years onwards, and every year from 50 onwards. That's the frequency, every year. Unless you are on drugs, you need a monitor. That is what is important. So this is how the medical checkup should be done. And you do it once and think things are fine. Is it okay? It's only the blood test that is not alone enough. You should have a comprehensive checkup. Everyone knows there is one common disease happening to everyone. Those who visit a doctor, it's sabka hi hota hai. What is that disease? Fatty liver. Every report gets a fatty liver. Why? Because all Indians, majority of Indians, the tune of 85% are obese. You will say, I am not obese, I am just having a 50 kg weight, height is also less. Indians and South Asians are abdominally obese. We are abdominally obese. And reason is again the sugar. Because the fructose content of the sugar is the culprit. And fructose, why I'm emphasizing, people will ask, what about fruits? We get good amount of fructose from fruit. But fact is, for liver, fructose, whether it is from corn sugar, cane sugar, or from fruits, it gets dumped into your, and that is a precursor of insulin resistance, which leads to diabetes. I'm not talking very technical terms, but fundamentally you should understand, if you have abdominal obesity, avoid all kinds of carbs. That's why I said, which is good or bad for our health. Bad for health is more bad for healthy sugar. Next slide. Now we are talking AI. Does AI any role in our health? Can you make out how much money will you earn after 15 years through AI? Possible? But health areas mein AI is being entered, which can have a predictive and preventive value based on health resource assessment. What your figures are there? What is your blood reports? What is your sonography report? What is your treadmill report? What is your ECG report? What is your echo report? When they are compiled and they are being monitored for a prolonged period on a regular basis, not that you do it once in a year and then forget everything. And unfortunately, in our area, our corporate clients, have relatively very higher numbers of blood pressure, because we get our blood pressure checked up only with the doctor's clinic. When we do some exercise at place of work, blood pressure suddenly incidence goes up to 40%. So people do not realize that they are working, but they are working in stress. Why should you have a stress when you are working? Unless you are, robbing somebody or planning to kill somebody and fearing about police and all blah, blah, blah. There should not be any stress while. So we have this kind of arrangement also at Apollo where we do testings, but we keep a track of person. If someone's report has come wrong, we check with the person, follow it up. Your cholesterol was this, you were given medicines. What is your status? What your weight was this, you were asked to reduce your weight by this. So these are the follow-up methods. Next slide. Thank you very much. Now I am open to questions.
बालकनी में सर मैं एक्सरसाइज करता हूँ 4 बजे, मतलब चाहे संडे हो, कोई छुट्टी हो, दिवाली हो। इवन मेरे सर किडनी स्टोन का ऑपरेशन था, उस दिन भी मैं 4:30 बजे उठ के सेम एक्सरसाइज की। मेरा क्वेश्चन ये है सर कि एडिक्शन जो है संडे हॉलीडे करना चाहिए या कंटिन्यू 365 है तो कंटिन्यू एक्सरसाइज जो है तो
मोर द बेटर। सिंपल, जितना आप कर सकते हैं आपकी कैपेसिटी, मोर द बेटर, देयर इज नो रेस्ट्रिक्शन। आई टेल यू वन थिंग, I just ask simple another question. What is your food habits on weekends? Your food intake is less or more? More, right? Few or less, but majority is more. Why? Holiday. Because food is a relaxant, right? You feel that enjoyment of food is a relaxation, right? But do you think someone else bear the burnt of all this your relaxation? Who? Pardon? And heart. Because heart is the only part which starts working 7.5 months before you are born. Right? And it is the last thing to leave you. So for heart, there are no weekends. Keep this thing in mind. You take more rest on weekends is also not good. If you are sitting for more than 2 hours on your chair, is as good as cigarette. And cigarette smoking is dangerous. Right? So any one of you who are having any kind of meetings which lasting for 2 hours and you are sitting on your place for 2 hours, ensure your colleagues and your bosses that have a break. Continuous sitting is equally bad. And you know how often we sit? We sit whole day. Am I right? Start from your morning loo. Yeah, tell me. Indians and South Asians, yes. Basic reason है ना कि we are predisposed to the sugar toxicity. Yes, if you stop it, the best. Pardon? Alternative sugar, natural carbs. Natural carbs, they do have sugar. Whether you have rice or whether you have a wheat or you have millet, they all have sugars. Not good. Jaggery also is the same. Sugar. Jaggery is 65% sugar. It varies with your illness. irrespective of your age, your total cholesterol should not be more than 200. HDL cholesterol, good cholesterol, should be more than 40. And bad cholesterol have ranges. If you have heart problem, if you have diabetes, if you have obese, so there are LDL cholesterol. Blood pressure standard is 120/80, if you can achieve it. Above 140/90, you have to take medicines. It depends on the level and your existing illness. If someone has a heart problem, irrespective of exercise, he has to take medicines. Diet control has to be there. Pardon? Avoiding too much of oily foods. And that includes all sort of oily foods. How much? Water, 3 to 4 liters every day. Up to you. Only thing you should ensure that if you take good amount of water, then you should not skip the meals. What? Cholesterol. Total cholesterol or sub LDL? Okay. Generally 2 months, check it again. But then what is the additional condition? Why I started giving the 120? Either you have diabetic, family history of heart, blood pressure, BP is there. So for it only alone BP, nothing else, up to 130 LDL is okay. See, standard guidelines are slightly different from Indian guidelines. We do not take any chance in India for such kind of things. If you have BP, have it and check it for 2 months. If it reaches 100, you can stop the drug. Unless you have a heart attack. Those who have heart attack, who have family history of heart attack, for them it is 70.
I am sorry to interrupt. We would now be concluding the session. You can all connect with Sir off stage and get your queries cleared. Thank you so much, sir, for such an enlightening session. Nourishing our body is definitely of utmost importance. They say that you can have...
Let me end up with saying,
yes,
thanks to the organizer of this program. They gave me an opportunity to talk on this topic, because it is maybe a finance related conference, but keeping a such kind of a topic is a very good idea. Thank you very much.
they say you can have 1,000 problems in your life until you have a health problem, because then you only have one problem in your life. So make sure you always remember that. And thank you so much, sir. I would be requesting our Central Council member, CA Piyush Hajar, sir, to kindly felicitate Dr. S.K. Nigam for this brilliant session. Can we once again have a great round of applause, please? We would be presenting him a memento as a token of respect and appreciation. Make sure we all implement those 5 golden rules: working out 5 times a week, avoiding sugar, taking 7 hours of sleep, and of course, a good diet. Thank you so much, sir.